Hello everyone and welcome to Inside Healthcare. I'm very glad to be here. I slipped on the ice in December and severely injured my left shoulder and my arm, breaking this large bone, the humerus bone, and underwent surgery the week before Christmas. I'm on the mend now and doing very well, and would like to thank everyone at Woodlands Health Campus, from the emergency department to radiology to the OR to orthopedic and physical therapy department, as well as a big thanks to Dr. Robert Nolan and his team at St. Croix Orthopedics. Thank you so much for getting me back together. So besides weather-related injuries, doctors and nurses in the hospitals are seeing lots and lots of flu cases right now. The Minnesota Department of Health has reported at least 4 flu-related deaths, including a 17-year-old. To answer your questions about this year's flu and how you can protect you and your family from it, we're very pleased to have back with us Dr. Ryan Dick. He's a family medicine physician at the Healthy Spanish Heights Clinic. Thanks for coming back and being with us. Appreciate
absolutely.
it.
Thanks for having me back. I'm glad to see that you are doing better as well.
Yes, I am. So what are you seeing in the clinic so far?
We're seeing probably a higher than expected year in regards to influenza. We're seeing both influenza A and B. There are a lot of cases that are coming in, and we know that there's a lot of cases out there in the community that aren't getting a formal diagnosis. But the symptoms are ranging pretty dramatically, anywhere from just getting the sniffles to more significant fevers, 101, 102, cough, aches and pains in the muscles or joints. And so someone could have some of those symptoms or all of those, and it can last for anywhere from a few days to a week and a half.
Well, it's very long this time.
Yes,
a little bit longer. You were saying even within your own family.
Even within my own family, we all got vaccinated, and for better or for worse, we all were diagnosed with influenza A. And actually my family kind of bore the brunt of that same spectrum. I had sniffles, and I think that is because I did get my flu shot that I had milder symptoms. And then there were other family members who did have a little bit of a fever, did have a cough, and so on and so forth. So even though I was immunized, I did get it.
And why is that?
Well, the reality is that on a good year where we have a flu shot, most of the time we see about 80% effectiveness. So 80% of the people who get a flu shot will not get the actual illness itself.
That's pretty good odds.
That's 80%. Pretty good odds, and that's a good year. So I mean, on other years you might see a little bit more influenza-related illness even for people who get the shots. We do think that people who do get shots, even if they get the illness, will have milder symptoms. So they might just get sniffles, like what I had for about 3 or 4 days, and they won't get the full 102 fever, lay in bed, be exhausted for a week and a half, and I think it was effective in me. And
who's at most risk for getting it? Just general public, anyone?
Anyone can get the illness itself. There are certainly some high-risk groups of people who we worry more about: small kids, older adults over the age of 60 or 65. Pregnancy patients, a lot of my pregnancy patients, I was very insistent, as long as they felt comfortable anyway, in getting the flu shot, because they're at higher risk for complications of influenza, such as pneumonia. And then other people who have other illnesses, heart-related illness, kidney-related illness, and other issues as well.
So even though the flu vaccine is not 100%, if you haven't gotten a flu vaccine, is it too late to get one?
Absolutely not. This is a perfect time to get a flu shot. If you come in and your family member has been ill with influenza, there's a good chance the shot will not work in you, but it doesn't mean you can't be protected down the road if you got exposed on a couple different occasions.
And it takes a couple of weeks to be fully immunized?
It takes about 2 weeks for the shot to work, so this is the time to get a shot before you start getting exposed to someone else, whether that be at work or in your home.
Is there anything you can do besides the flu shot to kind of protect yourself and your family from coming down with the flu?
There's a couple different ways. I mean, some of it involves common sense, making sure that you limit the amount of exposure. If you have a mild cold or you have mild symptoms, it might not be the best time to come in the clinic if you have mild symptoms, because there's a lot of other sick people in the lobby. So you have to be you have to be a little bit diligent in deciding, okay, is this a mild cold? Is this something that really needs to be seen by a physician right now, when I know there are a lot of people sitting in the lobby with maybe more significant illness.
That really raises a good question. I mean, when should you go to the doctor, or even more to the hospital if you think that it's even more severe?
If you're in one of those high-risk categories, that's probably one of the bigger factors. So if you have a young child, you are an older adult, if you have already some lung or heart issues to begin with, and then you're also suspicious of having influenza, including that pregnancy category as well, that's a really good time to be seen in the clinic. The other piece of it is if you're having more severe symptoms. So we're obviously beyond the nasal congestion. If you have a significant cough, significant fevers, if you're having a hard time hydrating yourself, having difficulties with breathing, those are all really good reasons to at the very least call your clinic, but probably needs to be evaluated with a lung exam and some other tests.
So what advice do you give to your patients on how to treat it, or when they're at home and things like that?
So for healthy individuals, this oftentimes can be just treated by addressing the symptoms. So addressing it with ibuprofen, Tylenol, taking care of the symptoms themselves, and being diligent that if you do have severe symptoms or more significant symptoms, then come in for an evaluation. For the people who need to be more thoroughly addressed in those high-risk categories, for example, when they do come in, there are antiviral medications that are available, and sometimes we need to use those in order to combat the illness. Antiviral illness is not, or should I say, antiviral medication is not for everyone, but for high-risk groups, it is oftentimes used.
And some of them are even prescription, right?
Prescription strength medications, and that is probably most commonly used in the more significant cases, and oftentimes in again those high-risk individuals who might develop a pneumonia as a result of influenza itself.
And I would think anything that you can do to build your own immune system as well, I think all of that would be helpful as well.
Absolutely. I mean, for patients who are trying to improve their overall health, obviously this is a good time to quit smoking. I mean, and reduce the risk.
You don't even think about that, yeah.
No, I mean, and then obviously limiting your exposure, to other individuals. Being aware that there are other individuals in the house or in other parts of the family. This is a good time for big family get-togethers, and being aware of who might else be ill around you.
Yeah, I think I mentioned this is one of the silver linings of getting injured around the holidays, is that I didn't get to visit with a lot of relatives and family.
Right.
So I've been fortunate that I haven't picked up any.
Might have limited what kind of illness you could pick up, yes.
Final comments for our viewers on fighting the flu this season?
The big piece is making sure that you do get your flu shot. Tamiflu, which is one of the more common antiviral medications, is not a magic bullet. For the majority of healthy patients, it only limits illness by 1 day. And so for the most part, for those individuals, for healthy people, it doesn't take as big of a role. For our other people in the high-risk categories, it can be a very effective medication, and it oftentimes will be used.
All right. It's always a pleasure to have you on the show. We appreciate it. As always, thank you, Dr. Ryan Dick with the Healthy Spanish Heights Clinic.
Thank you so much. Yeah.
And still ahead, what if you have this cough? How do you know if it's a cough with the flu or a cold, or if it's allergies? We'll tell you when we come back. Stay with us.
Horseradish. Is that for horses? Remember me, Mr. Lobster? From last Tuesday? Banana. 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 Here comes the rain. We need a hat. And why do we need a hat?
Say John.
That's right.
When you talk with your child, you build vocabulary, and learning starts long before school does. For more tips, go to bornlearning.org.
Welcome back, everyone, to Inside Healthcare. Joining us now from the Healthy's Allergy Care is Dr. Stephanie Fox. Thank you for being with us. She's a board certified in internal medicine and board certified by the American Board of Allergy and Asthma and Immunology. So often we hear about allergies tied in with spring, with the pollen, and then also hay fever in the fall. So what type of allergies are you seeing now during the winter months?
So the most common thing we see during the winter is actually asthma exacerbations. Asthma is an allergic disorder, which most people aren't aware of. But they usually come to see us during spring and fall, but viruses also trigger their asthma.
Like the flu.
Like the flu. So with the flu season being so prominent this year, we've seen a lot of the asthma exacerbations in our clinic as a result of the respiratory illnesses.
Have some of the patients have to be hospitalized then as a result too?
Some of them do, but if most of our asthmatics know when they're having an asthma exacerbation, and they have a plan, and they know that to contact us early. So if they contact us early, we often can effectively manage their disease so that they don't end up in the hospital.
So how do you know when your cough is caused by allergies versus the cold or virus or something like that?
That's a very good question, and actually it's very hard to differentiate. The biggest thing is colds usually last 3 to 14 days. They're time limited, where allergens can last days to months. It just depends on how long the person is exposed to the allergen. And the symptoms tend to vary. With colds, they can be anywhere from the yellow mucus, they have fatigue, aches and pains, sometimes even fever or sore throat. But with allergies, it's more irritated symptoms, so sneezing, itching, watery eyes, nasal congestion, and the mucus is usually clear.
Sounds like a lot of flu, though. That would be
very
really hard to
similar.
tell. So when should someone come in and see a specialist like you versus going to see their primary care doctor like Dr. Dick?
Sure. So the most important thing is if their allergies are interfering with their day-to-day activities and they're being controlled on conservative therapy or over-the-counter medications and they're still having breakthrough symptoms, that's when they need to come see us. Or if they have more serious symptoms such as asthma, shortness of breath, cough at night, cough that's waking them up during their sleep, or cough with heavy exertion, they probably need to come see us. Asthma patients who are on daily medications, who are not controlled, meaning they're having breakthrough symptoms of the cough, wheeze, or shortness of breath, really need to be evaluated by a specialist as well.
Yeah, it could be very serious and life-threatening.
Yes, asthma is a fatal illness, so it needs to be managed effectively.
Yeah, I think the first time I learned of a friend who had passed away from an asthma attack, I had never realized it was that dangerous before. So what kinds of treatments do you recommend for patients that have allergies during the winter months?
So during the winter months, many patients are able to get off their medications. A lot of patients have spring, summer, fall allergens, which are trees, grasses, and weeds. So they often don't have to take their antihistamines during the winter time. But I often recommend they continue with their nasal sprays. Nasal sprays are usually corticosteroids, and they decrease inflammation, so they also help sometimes with viral illnesses and things like this. So I do sometimes recommend they continue those, but some patients are able to take a holiday during the winter.
You know, and also too, I was thinking just watching some of the playoff football games, like in those, like Florida, and it's like 71, it's green and everything. So I would think with a lot of our snowbirds that maybe if they have allergies or asthma, that could be triggered when they go down to the warmer climates as well?
It can be. They do have some different allergens down there, so it would take a couple seasons sometimes for those people to get sensitized. But for example, Florida has a big problem with dust mites because of their humidity. So they might have more problems when they go down there if they're dust mite allergic.
So what would you recommend to maybe a snowbird who's going to be leaving for Florida next week or something? What would you recommend to them?
So I probably would recommend them taking their antihistamine before they go, taking it with them, seeing if they can manage it only with their antihistamine or their other medications that have been prescribed by their allergist if they have more severe symptoms.
Anything else that our viewers should know about allergies at this time of the year?
So it should be important to know that this is a great time of year to come see an allergist. Oftentimes people wait until March or April when they're quite miserable with their springtime allergens. And to come to our clinic, if you want to be tested, you have to be off your antihistamine for 5 days. So coming in January or February, where it's not as big a deal to be off your antihistamine for 5 days, it's a great time to come see us at this time. But we also manage drug allergy, food allergy, hives, eczema, lots of other disorders as well under the allergy umbrella.
And we just have a couple more seconds, but what would be some of those other things that you just mentioned, the drug allergies?
Drug allergy. So for example, penicillin allergy. If someone has a penicillin allergy on their chart, most people outgrow it after 10 years, and we offer testing for that specific drug. So that would be something they could come and see us for.
And then I think we hear more and more food allergies as well.
Food allergies. Yes, food allergies and intolerances are well known in our community, and it's very important to differentiate between the two. Food allergy is hives, swelling, and shortness of breath after eating the food. But you often hear people say they have a food allergy if they have a headache or other symptoms, and that's not necessarily a true allergy.
And then how can you find out if truly your headache and that is being caused by something you're eating or being exposed to?
Unfortunately, there's not great testing for that. Really, I tell patients to keep a food journal and kind of chart their symptoms and see if they can figure it out from there.
Final comments for our viewers?
Just letting them know that it's no reason to suffer. There's lots of good therapies available for allergies, so they should seek help if they are having breakthrough symptoms.
All right. Thank you, Dr. Stephanie Fox, for being with us. We appreciate it.
Thank you for having me.
And if you want some more information for the Healthy's Allergy Care, you can call 651-326-1044, 326-1044. So still ahead, you'll meet a local woman who says her mammogram saved her life. Stay with us, everyone.
Just a reminder, kids who participate in high school activities tend to go a little farther than those who don't. Take part. Get set for life.
Welcome back to Inside Healthcare. Recently, a new study came out questioning the value of mammograms. In a moment, you're going to meet a local woman who says she wouldn't be here today if it wasn't for her mammogram. But first, let's take a look here, share a story.
She got the phone call. We had no idea what was going on, and Mom just started crying. And we didn't find out till a while later, till she had cancer.
How do I tell him? I mean, you know, Carson just started kindergarten, Coop was in 3rd grade, and now I have breast cancer. I was just going to have a double mastectomy with reconstruction. That was the plan after meeting with the surgeons, and that's plastic surgeons, and that's what we were going to do. We, unfortunately, we knew about chemo because Carl's dad had been going through it because he was diagnosed August before me. August of '08, he was diagnosed. And then I was diagnosed in October of '09. And the day that I had my port put in, Carl's mom was diagnosed with lymphoma.
It's really feel overwhelmed. I think it's probably the best descriptor, because you're trying to balance two different families, really. Your own, you know, mom and dad, and then also Cher and my kids, and trying to be in the 3 different places simultaneously sometimes when there's different chemos going on or there's different treatments.
First, it was all like feelings, then it got into emotions. First, we were all happy, then it went into sad, then it went angry, feeling angry at yourself. And probably one of the funniest things that I remember is Carson duct taping Mom's head. She would get these little hairs that would come off right away. So you'd take rolls of duct tape, take a piece off, then stick it on the hair, and then just rip it off.
Country.
What?
Country.
4.
And we couldn't have done it without a lot of help. There's just no way. I couldn't have done it without the help of all of our friends and, you know, healthy staff, and just who were there. And I knew if I couldn't be at an appointment, I knew that she was taken care of.
Mom wore hats all the time because she was bald. But we had a hat party, and everybody brought in a hat, and we got a picture, and it was just really fun. We played games and stuff. It reminded me of good times before cancer happened. Sort of like my good mood food.
You know, sure, if she hadn't have got treatment, you know, I'd be alone. So things are much better.
Healthiest made just a huge difference for us. It made a difference for me. It made a difference for my kids.
Thank you. Thank you for your support. I mean, that's what it gets down to. Nothing else I can really say is gonna add to that very much. I mean, I have my wife.
Bam! We know you or what?
And we're very pleased to have with us Cher, her husband Carl, Cooper, and Carson. Thank you everyone for being with us, getting out of school to be with us today. Appreciate that. A tough job, right? But someone has to do it, right?
Yeah.
So leading into your story, Cher, and thanks so much for sharing your story with our viewers. There was a study that came out around Thanksgiving time, I think it was, saying how mammogram screenings maybe aren't helping to save lives, and I know that you both totally disagree with this study. What do you tell people when you hear a report like that or a study coming out?
I mean, you really have to think about what they're saying in the study. They're saying that you need the or you don't need a mammogram because all breast cancer, you're gonna find it with a lump. Mine wasn't. I didn't have a lump. I did my self-exams. I actually started getting mammograms when I was in my 30s. It was just one of those things that I felt, you know, you go to the dentist, you do all of that. Why not be proactive and get my mammogram? So I had done that. But when they found it, there was no lump. It was throughout my breast. So if we hadn't had the mammogram, with as aggressive as it was, you know, we couldn't have waited for the lump.
No. And it's very interesting with these studies that it's obviously very important to evaluate and review all of the procedures that are used in healthcare. But there isn't really an alternative that's being proposed. I mean, it's, you know, there are some problems perhaps with the efficacy of the mammograms and how they're done or how effective they are and so on, and you can certainly have that discussion. But I think an important addition to that discussion has to be, well, if that's not going to work, then what are you going to do? Because there's a lot of patients that rely on them currently, that's really the method of identifying early stages.
And I'm afraid that it gives the wrong message, that women are going, well, I don't need to go do that then. You know, they're saying it's not effective, why bother? And
yeah,
you know,
exactly.
It definitely gives the wrong message.
Yeah, and it would be very easy for women to say, well, if it's not going to be effective, they're uncomfortable, I don't want to do it. I mean, women already don't want to go get them. I know after I was diagnosed, there was a number of women that would say, oh, well, what can I do? You know, can I bring you a hot dish? I said, no, get your mammogram. Yep, but could I do something else for you? It's like, no, get your mammogram.
Yeah.
We were very vocal about it, that people needed them. And
because yours was very aggressive, and if you hadn't, you wouldn't.
No.
Yeah.
We don't know where we would be right now.
Now, you were telling me that you're always one of those that kind of colored within the lines, always did all the right thing, and then bam, this happens. And it's like you've been very healthy and no family history. And
No. I mean, that's part of the reason I was getting my mammograms. You know, I would do everything, my annuals, my mammograms, my dental, everything. To the point that when I was diagnosed, people are like, you have what? It's like, but you're healthy, you exercise, you do it all. So, I mean, it can be anybody. It's not, you know, October 28th, we became one of those other people that we always thought, oh, you know, other people get it. And
yeah, it was very funny because she had just started on a health exercise program. She was trying to eat better. She was trying to get me to eat better, and you know, then she was diagnosed.
But I'm sure that helped you through the whole healing
did.
process.
Oh yeah,
it definitely did.
Yeah,
we were in a much healthier place to get through the process.
And this is something that we've noticed too, that when mom gets cancer, dad gets cancer, it affects the whole family.
Oh, definitely.
You know, and Cooper, you were saying in the video that your class kind of put this event together. Why don't you tell us more about that?
Yeah, it was in 3rd grade, and some people knew that my mom had cancer, so we organized a hat party, and everybody that day brought in a hat.
What did you think about that?
I thought it was pretty cool.
Yeah.
Yeah.
You guys were kind of like the celebrity in the classroom and stuff?
Yeah.
And Carson, you were telling us about your experience helping your mom with those hairs and stuff with the duct tape. And
yeah.
What was that like?
Actually pretty funny. We would just find some rolls of duct tape, and it wouldn't hurt her, which was good.
Were you scared that you might hurt her doing it?
Sometimes.
Yeah.
Yeah.
But you felt like you were helping your mom then?
Mm-hmm.
And you were telling me too that now, because of your mom having gone through this, you're thinking of a different career, maybe even becoming a doctor?
Yes, I want to be a doctor because I want to help save people's life, like my mom.
It just came to you one day, you just said, this is what I'd like to do now?
Mm-hmm.
Well, I'm sure you'll do that then.
Both of the kids, when I was going through all the cancer treatments, we were we let them know what was going on. So they were at the hospital with me. They were at my chemo appointments with me. We kind of did the whole, they knew as much as, they could handle for their age, but we never hid it.
Yeah, I think that's really good to help, because otherwise it's so scary to begin with, and then not knowing what's going on, and to see your mom going through this.
And with the school, by having it as public as we did, it helped them at school too, so they could talk to anybody at school. And
we have just about a minute left. Final comments from everybody. Carl?
Get your mammograms.
Yeah.
Obvious thing to say, but it's very important. Until an alternative is found, for me, that's very critical.
Carson?
The radiation treatment, the radiation thing, it looks like a Star Wars ship.
Very cool. So, other kids that might watch, what would you tell them? Cooper?
It'll all be over soon.
It just seems like a nightmare or a bad dream now, looking back.
Yeah. Thank you for your support.
Yeah. And Cher?
It's important to pay attention to your own health, get your mammograms, and it's okay to let people know what's going on. That's the best way to get the help that you're going to need.
Well, I can't thank you enough for sharing your story with our viewers and coming here to be with us today. Thank you so much.
Thank you much.
Thank you.
Cher?
Thanks.
Cooper and Carson. Thank you, guys.
Thank you.
Thank you.
And I'd like to thank you for joining us. We hope you'll join us next time on Inside Healthcare. We'll see you then, everyone. Thanks.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.